On this segment, I want to talk about using cognitive behavioral therapy with athletes. I have found that not only is this a very useful approach to working with people at large, in fact, most of the research that I see today shows that cognitive behavioral therapy happens to be one of the best, if not the best and most successful approach to helping people through their issues in life. But I find that it is very successful when it comes to working with student athletes. And I want to just quickly go over the basics. Obviously, there's entire courses done around cognitive behavioral therapy, so we won't go into all the detail here in this program, but I do want to highlight some of the important features that I think will allow you to more quickly build trust with athletes. And obviously, as you're able to build trust, that's when the real magic occurs, where you're able to help a person work through his or her issues. And so this is an approach that I have found to be very, very successful. And there's some versions or modalities under the cognitive behavioral umbrella that I want to highlight here today for you. But let me just offer some of the basics here for those of you that maybe use a different modality or have a different orientation to counseling. With cognitive behavioral therapy, CBT, the basics helps patients understand that thoughts and feelings actually influence behaviors. And so, when I do these lectures, I help people understand that, they actually both intertwine. How you think about situations has a great impact on the behaviors or lack of behaviors that you engage in. But also sometimes just engaging in a behavior without thinking about it will prompt you to have a perception and an understanding of something. And so, the two really do work hand in hand. With CBT, people learn how to identify and change destructive and disturbing thought patterns that often have a negative influence on behavior. And we'll talk about some of these examples in a moment. So, the underlying concept here with CBT that's different than maybe some of the other approaches, such as a psychodynamic approach that is more heavily invested in more abstract concepts like an id, ego, and superego. Here, it's very tangible, very in the here and now. We look at how thoughts and feelings play a fundamental role in our behavior. If you have dichotomous thinking, for example, what we call all or nothing thinking, chances are that's going to really hinder your life. People and situations and events tend to happen in the gray areas. Of course, there are some things in life that are all or nothing, but a lot fewer than we think. So that might be what we call a cognitive distortion. Another would be, the perfectionist. I see this a lot in athletes, where student athletes will become upset maybe if they set goals that they haven't reached, and they find that anything short of reaching that outcome is a failure. And so one of the things that I do to help them kind of loosen that thought process up a little bit is get away from the word perfectionist and instead strive for excellence. It gives you a little bit more wiggle room, a little more latitude. If you fall short, you can still have an excellent experience. And let's face it, whenever you're saying you're a perfectionist, you're essentially saying anything less than perfect is a failure. And as we all know, that's really setting yourself up for a lifetime of stress and frustration. But yeah, I think that CBT approaches in general are good because they make sense to athletes. Again, going and connecting the dots with some of these segments. If you are fortunate enough to have a student athlete voluntarily come to your office or come to your practice wanting help, not only will you lose him or her if you have no understanding of their sport, but you might also lose a student athlete more quickly if you have a more abstract approach to counseling. And this is not a knock on some of the psychodynamic approaches or someone maybe who's more into Gestalt or something like that. That's not the purpose here, but I guess what I'm sharing this for is that in my experience, and I've had many, many, many years of working with pro, college, and youth level student athletes, I think it has to be a very grounded approach. It has to make sense to them. If they get the feeling that it's too much psychobabble or oriented to their past when really they don't have any childhood trauma to resolve. They simply want to learn how to write a resume, let's say. It might be a pro athlete who's going through retirement and wants to get a job and really doesn't have much interest or need to talk about earlier experiences in life, just wants to work on things that will help him move his career forward. So that's why I think this CBT approach is a very, very effective approach to working with student athletes. Now there's two approaches that I kind of borrow from when working with athletes, and of course there are many others, but for this program I wanted to introduce two. One is rational emotive behavioral therapy, and we're talking about Albert Ellis's approach, REBT. And the second I'll come to is reality therapy by William Glasser. But let's start with REBT. And the basic approach here, if you remember from any of your clinical counseling training, we're talking about the ABCs in life. And I love this model. It's in the here and now. It uses real life examples. Athletes don't seem to have much problem understanding this approach. But let me explain it for you in this program here. The A part of the model is the activating event. These are the things that happen to us in life. Sometimes they're things that we had an influence on, and sometimes things that just happen to us without anything that we caused or prompted to happen. The B part of the model is our belief or our perception of A. It's our own subjective experience that we apply to what has just happened to us at the A part of the model. And the C part of this model would include the behaviors that we engage in or the things that we do based on our perception in B, based on the event that happened to us in A. And so it's a real simple model. Things happen to us, we have a perception of those things, and then we typically engage in some kind of a behavior based on what we perceive. So let me give you a couple examples, a couple sport examples here that might come through your office if in fact you decide to work with student athletes. Now, how serious these events are I'm going to leave them up to you, but they are the kinds of things that might occur. And of course, as trained professionals, we want to respect and appreciate any issue that the individual is experiencing. It's not really our judgment to talk about it as though it's a trivial event. Of course, to the client, it's an important event. So one that I came up with here is if a student athlete is benched from a team. In the old days, if a student athlete got injured, for example, they wouldn't lose their starting position. But these days, that's not always the philosophy that every coach holds. And so let's take this example where you have a high school student athlete who has lost his starting position on the team, and he's really upset about it. And so, what you might want to do in applying REBT is look at the event. Okay, so the event here is a benching. The student athlete no longer has a starting position, and let's say that an injury occurred. So the injury pulled him from the starting lineup, and he's been rehabilitating the injury. And so the B part of the model is his perception about the benching. Does he accept it in a rational way that these things happen, life isn't always fair, maybe it was in the coach's best interest to continue to use the player who took my spot? Those would all be more rational views on the benching. An irrational view, you might say, could be if the student athlete already has written off any chance that he will be able to play college sports. I'm never going to get back in the starting lineup. I'm never going to be viewed by college coaches. I'll never have a chance to play. In most cases, with respect to most injuries, assuming they're not career-ending, that's simply not true. Some other, maybe more irrational ways to view the situation. You might have a student athlete who pins everything on the coach. The coach hates me, he's a jerk, this is politics, I'm not playing because my dad had some harsh things to say, which may or may not be true, but generally speaking, these are more irrational ways to view a situation. I try to tell kids all the time, I have never met a coach to this point in my life that will purposely not play you simply to make a point. Coaches get into coaching to win. Whether we like it or not, it's a lot more fun to coach a winning team than a losing team. And I simply don't know that there are that many coaches out there that will purposely play less talented kids just to get at a kid. If you're good enough and you're in good academic standing and you're not a problem to the team, chances are you're going to have a very fair chance to play. And so anyway, going back to this model, so we have in the A part of the model we have a benching. The B part of the model is how that student athlete perceives it. And then the C part of the model is what behaviors follow. So if it's a rational way of viewing the situation, chances are, if the youngster has said, hey, I was hurt, somebody else had to play, I understand, I respect the coach's decision. If that's in line, chances are the behaviors that will follow will be very positive, very facilitative. The student athlete will probably recover very quickly, practice hard, and in all likelihood probably get that starting spot back. However, those are generally not the situations you work with in practice. You typically see some of those more irrational thoughts, and this is where you want to look at what behaviors are following. So if the student athlete feels that it's all politics and the coach hates him, there's a good chance that he may cope with the problem by using drugs or alcohol. He may engage in reckless behaviors. He may want to go tell the coach off. The list goes on and on of things that really would not help the situation. And so those would be some of those action steps. So here is a perfect example of how REBT can be used. You, as the counselor, want to really hone in on that B part of the model. How are you perceiving the benching? Realistically, in a mature way, are you setting up your action steps to be positive? Are you setting future goals up? Are you going to talk to the coach in a very responsible way to find out what you need to do to earn your spot back? Those are all really good, positive things to do. If, on the other hand, you see that the student athlete is engaging in all kinds of negative behaviors, chances are you want to go back to the B part of that model. What is going on here? How have you developed such an irrational or self-sabotaging view of the situation? And that's where you want to really roll up your sleeves as a counselor and provide that assistance so that the student athlete can see there are better, healthier, more successful ways of handling that benching. So that's just one example. Let me give you a second one. It actually has to do with an injury. Let's say that the student athlete has a torn ACL, and that is a pretty significant injury. It may or may not be career-ending. In recent years, more advancements have been made in sports medicine where even youngsters are able to rehabilitate over time and typically go on to play again, unlike maybe 10, 15 years ago where torn ACLs could be career-ending injuries, and in some cases they still are. So what happens here? The injury is the event. That's the A part of the model. The B part of the model is how the student athlete views the injury. Does he or she see it as career-ending? Maybe something they caused? Maybe they'll look at the world as unfair and unjust and have all these kinds of ways of thinking. Or do they look at it in a more rational, responsible way that injuries are a part of sports? They happen, they're often unavoidable, and that the real question now should be, how can I rehabilitate? How can I engage in a rehabilitation process that not only helps physical recovery, but also addresses the mental aspects of the injury? And so that would be a more rational approach. Now, let's go back to our model for a moment. If the athlete has an irrational view of the injury, chances are the actions that are going to follow are going to be all those negative things, which could include, again, drugs, alcohol, reckless behaviors, depression, anxiety, eating disorders, all kinds of different things that are unhealthy coping mechanisms to the stressor. If, on the other hand, you are able to therapeutically help the student athlete frame the injury in a more rational, realistic way, then it makes it all that much easier to set up a goal-setting program, for example. to help the student athlete set specific, measurable, controllable goals to get through that transition of dealing with the injury. You might even work in cahoots with other athletic personnel in your school or community, coaches, athletic directors, league operators, and find out, are there other student athletes who have gone through a similar injury? How can you maybe hook your client up with one of those people to kind of normalize the injury rehabilitation process? You might go on the internet and go to legitimate websites like WebMD and find out what is the normal protocol to help an athlete go through this type of an injury. So there are a lot of things that you can help, and in essence what you'll be doing is helping that student athlete not only attain good information but also take control of the situation. And we also know that when we feel in control of situations, we typically have a higher level of self-efficacy, and that is directly related to a better chance for an injury recovery, or in sports, a higher chance for a better performance. So, confidence, self-efficacy is very important. And so, again, if we look at some of the things that we can do, clinically speaking, we can help the athlete get information. We can also link up that student athlete who's dealing with an injury. We can help him or her engage in behaviors that will address the mental side. Maybe there is a support group that you can link the student athlete up with. Or maybe you can help him or her find other ways to stay busy and not be in isolation where all they have is that time to think, because not every coach and every team will keep the kid a part of the team. Some coaches are better at this than others, but the worst thing we want is for that person to deal with the injury by him or herself in isolation and just have time to think and dwell on it. So again, those are two really important examples, a benching and a serious injury. In both examples, we really want to focus on the B part of the model and help change what might be irrational thinking into more mature and rational ways of looking at those situations. A second approach that I want to mention here is reality therapy. This is William Glasser's work. Another really nice approach to working with student athletes. Just like the name implies, it is reality-based. Again, it's not looking at abstract structures. It's not looking at what might have happened in early childhood. It's staying in the here and now. Reality therapy maintains that the individual is suffering from a socially universal human condition rather than a mental illness. Think about that. So we're not even framing it as a mental illness, but instead a socially universal human condition. Basically, we all go through these ups and downs in life. There's peaks and valleys in life, and this is kind of a normal experience, the reality therapist would say. So we're not concerned with unconscious mental processes. The focus is problem solving and staying in the here and now. So I want to read a quote from this approach that I think really kind of sums up reality therapy quite nicely. Simply because someone is experiencing distress resulting from a social problem does not make him mentally ill. It just makes him out of sync with his psychological needs. So with a student athlete who might in fact be dealing with an injury, yes, he's probably experiencing a lot of distress, but it doesn't necessarily mean that he has a mental illness or is suffering from psychopathology, but instead it might imply that he's out of sync with his psychological needs, and in this case he would be out of sync with the need to be a student athlete, the need to be engaged in physical activity, the need to be involved in a team setting, the need to push himself with respect to goals on the field, that he develops self-confidence, that he then parlays over into other aspects of life. You see, this list goes on, but none of these things are implying that there is a mental illness here, but instead maybe a temporary disconnect. And I think therapeutically speaking, when you're able to convey that type of philosophy with a student athlete, that really changes the paradigm. It allows your client, the student athlete, to see, hey, this is a normal experience. I'm not the only one who's ever gone through this. I simply need to build a better mousetrap and I'll have those results again. And so, you might look at, going back to that earlier example of I gave you two in the REBT example. If there's a benching, if a kid loses a starting position, you might want to look at strategies of how are you going to get that starting position back? What are some sensible approaches that are rational, that make perfect sense, that are tangible, that you can do, setting goals, getting stronger, becoming more mentally tough, and so on. With respect to the second one, if you have a serious injury, and maybe it is the end of a career, let's say, for example here, that it is, the discussion or the therapy might center around specific things that the athlete can do. Do you have the job training needed? If not, and if you're talking about college and pro athletes, that is often the case because it is not uncommon for a college student athlete or a professional athlete to have very little, if any, work experience, so therefore they would not have a resume. They would not necessarily be equipped to do a job interview. And so if that's the case, you really are starting from ground zero. How do you start to build that person up? Athletic transferable skills are a nice place to start, but I'll come back to that in a little bit. So let's talk about when the career ends. Do you have job training? If not, how do you link the student athlete or former professional athlete up with the job training that he or she needs? Do you have a resume? Again, probably not. So how do you begin to help that person develop a resume? And you might need to be very, very creative here, especially if the person has little to no work experience. Can you write a cover letter? Again, chances are, if you're talking about an elite level or professional athlete, they probably have never had to do that before, so you may need to help them in that process. But these are all examples of keeping a very here and now relationship, engaging in activities that are very normal, allowing the student athlete to actually see evidence of his or her efforts, that these things really do make a difference. They not only help the student athlete become a better prospect for a job, for example, but it also helps with self-confidence. We feel better, again, when we're in control of our lives, when we have a game plan, when we feel confident that we might actually get that next job or be able to work up the corporate ladder. So all of these things can really, really help when it comes to providing therapeutic assistance to student athletes. So let me kind of sum up this segment before we move on. Again, there are many different therapeutic approaches and modalities. I personally believe that the cognitive behavioral approach will give you the best chance to being successful as student athletes. Now, there may be others that see that differently, but as far as my experiences go, I really believe that. I think it's important for student athletes to see that thinking and behaviors are interrelated. Sometimes it's working on irrational thinking, and sometimes it's simply engaging in a behavior. For example, what I just said a moment ago, really pushing a student athlete through to developing a resume. They may not really have any thoughts about it. They may even complain that they have to do it, but by you helping them create one, now they have one in front of them, all of a sudden, cognitively, they feel better about themselves. And so, it's kind of what came first, the chicken or the egg. I think it's important to look at both. I think that both are so intertwined, how we perceive the world around us, how we interpret it, as well as the behaviors that we engage in or don't engage in are very connected. Drilling deeper with the cognitive behavioral approach, Ellis's REBT is a very nice model for you to use, very easy to understand, very easy for your clients to understand. In fact, if you have a dry whiteboard behind you like I do, you might even draw up, what is the event that you're dealing with, what are the ways in which the student athlete is viewing it, and what are the outcomes that are likely to happen or are already occurring because of faulty, irrational thinking. I wrapped up this segment by talking about reality therapy. Again, I would encourage you to take a closer look at Glasser's model here. I think it's a very fruitful model to borrow from when working with student athletes, and it just, again, keeps things in a very, normal approach, and that is vitally important here. So think about how some of these ideologies, philosophies, approaches can be used in your practice so that you have a greater likelihood of helping the student athletes that you work with get through the issues and situations that they're experiencing.